The prostate is a walnut-sized gland just beneath the bladder in men, and as a man ages, the prostate can become enlarged, which squeezes and can even close the urethra, preventing flow of urine. The primary function of the prostate gland is to produce fluid that nourishes and transports sperm. So the sperm comes from the testicles, and then it becomes mixed with the seminal fluid, and what comes out of the penis is a sort of sticky fluid containing the sperm. And so the prostate here helps produce that fluid, that seminal fluid that nourishes and transports the sperm. As a man ages, this prostate becomes enlarged, can block the flow of urine, and it's not caused by cancer. Uh, yeah, but it is a growth nonetheless. So, what does a man feel if the prostate is becoming enlarged? There may be pressure or feeling of fullness in the prostate area, a difficulty starting urination. The urine stream can stop and start. There may be a feeling that the man can't completely empty the bladder. There may be a frequent need to urinate with a dribbling at the end. You would may see high PSA levels. That's prostate-specific antigen, high PSA levels. And in severe symptoms, you get bladder stones, damage to the bladder, and if you can't urinate, you can get urine pressure building up and damaging the kidneys. So, can be a big problem. Prostate enlargement is rare before 40 years old, but by age 60, 1/3 of men have enlargement severe enough to require treatment, and by age 80, half of all men have severe enough enlarged prostate to require treatment. The risk factors are mostly kapha in nature: obesity, diabetes, sedentary lifestyle, erectile dysfunction. So all of those have a high coincidence with enlarged prostate. If your brother has BPH, you are 6 times more likely to have BPH, and that is it shows a genetic connection. I just want to say again, if I didn't say it already, BPH means benign prostatic hyperplasia. It's just the quicker to say acronym. All right, so in Western medicine, the cause is largely unknown. Uh, it's believed that inflammation is a factor, poor lipid metabolism. Also, um, there's some idea that testosterone is the cause. Um, that's testosterone getting converted to dihydrotestosterone, DHT, and then that DHT increases the prostate size. So that was one speculation. But that was like a theoretical speculation. They were like, oh, well, we know testosterone is converted to DHT, and DHT increases prostate size. So testosterone must increase the prostate size. But that doesn't quite make sense because testosterone supplements appear to be beneficial in cases of BPH. The research is complicated and not yet conclusive, but another suggestion is that there's an imbalance of hormones, that as a man ages, aromatase levels increase, and that converts testosterone into estrogen, and that it's actually testosterone depletion and higher estrogen that cause the BPH. And that I find that explanation a little more satisfying, simply because testosterone does get lower in men as they age, and you can measure estrogen levels. So that's in any case. The suggestion there is that hyperestrogen is the cause of BPH. When we look at it from an Ayurvedic point of view, it's Vata time of life, so we're going to expect depleted hormones. Growth of prostate is kapha in nature. If there's inflammation involved, pitta is involved. And when we're seeing a bunch of kapha risk factors, we're going to assume kapha is involved, right? These are just sort of Ayurveda's logic, that it's going to be kapha blocking pitta with stagnation in mutravasrotas, or the urinary tract, stagnation in the urinary tract, and depleted hormones due to Vata time of life. Traditional Chinese medicine says damp heat and drop in kidney essence, which is essentially the same thing. Damp heat involves blood congestion and essentially equivalent to kapha blocking pitta, or a kapha pitta disorder, right, where you have moisture and inflammation. And then drop in kidney essence is basically similar to the idea of a drop in ojas and depleted hormones. So, treatment protocol in TCM is going to be to resolve that pelvic blood congestion, anti-inflammatory, and nourish the sex hormones. So, herb actions are going to be testosteronic, anti-estrogenic, anti-inflammatory, and then a lectina, or a lymphatic decongestant. Lectina means scraping quality. It's going to scrape accumulations. We're looking to reduce pelvic blood congestion. And then traditional herb formulas recommend diuretics for BPH, but Western medicine says diuretics can worsen the symptoms because it irritates the urethra. So, not sure what to make of that difference. Study of individuals with BPH who were given Gokshura pills plus a coriander Gokshura ghee enema, coriander Gokshura ghee enema showed significant improvement in urine flow and reduction in the size of the prostate. So 70% of participants showed moderate improvement. And we're going to suggest this is particularly helpful in early stages of enlarged prostate. So if you're feeling that sense of fullness in that area, and you're showing any signs of interruption in the urine stream or difficulty starting urination, get going and start taking dietary, lifestyle, herbal measures. Okay, so here's some diet and lifestyle practices usually recommended for early stage BPH. First of all, practice properly emptying the bladder with double voiding, making an effort to urinate twice on each trip to the bathroom, 20 to 30 seconds in between. Avoid alcohol and caffeine. Alcohol and caffeine have a sharp diuretic action that can further irritate water channels. Drink less in the evenings. You don't have to, you're not peeing all night. Massage the prostate. So you could do that with Kegel exercises, the male equivalent of Kegel exercises. Pulling up on the anus and the testicles can help massage the prostate, but you can also pretty much massage the whole area with your finger. Exercise and movement can help as well. If the condition progresses, surgery may be needed. One thing I want to mention is that Gokshurati Gugulu is Ayurveda's formula for proper genitourinary function and reducing of BPH. But Gugulu is becoming endangered, so I usually don't recommend it. It's a slow-growing tree. Gokshura is going to be that lymphatic decongestant and nourishing those male hormones. Gugulu is also a lymphatic decongestant. Gokshura is also a diuretic. Triphala is going to cleanse the bowels, and Trika 2 is going to stimulate the heart. Here's our formula for enlarged prostate, interrupted urine flow with Vata. 3 parts Gokshura, 3 parts saw palmetto. Saw palmetto is a Western herbal apothecary herb of choice for BPH. It nourishes male hormones and is an anti-inflammatory. Then we're supplementing that dissolving blood decongesting quality by throwing in 3 parts Mangista, and then we have 1 part Ajwain, which is a warming diuretic that relieves pain.